Just a reminder to everyone, this is Conversations in Global Health. This is our fifth speaker of the spring series, Natasha Belmoria, a longtime friend, a distinguished expert in global health has had a wide variety of jobs, including a very exciting role right now in the Biden administration at the USAID, which we get to hear about. Well, let me just introduce briefly our guest, and everybody who's in the class, of course, has gotten a briefing email. But I think Natasha Belmore has one of the most interesting backgrounds of the people that we're going to see. She has a terrifically important position right now in the Bureau of Global Health at USAID. But she's also played this critical role in building support for first working for the Friends of the Global Fight that's supporting the Global Fund in the United States with the US government, executive branch, and Congress, playing a similar but a broader role even with Gavi, which we talked about during the course of the semester, the Vaccine Alliance. I mean, Natasha has a remarkable ability to explain and make the case for international engagement in the United States and with partner organizations. And I think it'll be just really fascinating. She has also an incredible career we'll hear a little bit about, but she's worked in the Clinton White House and had many other experiences in and out of government. So I think we are incredibly lucky to have her here tonight. Her experience in helping people understand the power and importance of global health and international engagement is really vital for our time. So with that, Natasha, I want to turn it to you and I ask you the first question I ask everybody, which is, as you met tonight, except for Matt, everybody here is in college. We were both in college once a few years ago. And I would ask you maybe if you could just give us a little bit of a story of your career, and in particular, how you got involved in global health and what sort of path you've followed. What drew you to the kind of work that you've been doing and what you're doing right now? And I think it would be terrific. So welcome.
Thank you. Well, so first of all, I just want to tell all of you what a pleasure it is to be with you all today. It's as these days are, they're incredibly busy and full of meetings, but it's really nice to be able to at least have my last meeting be one like this and really share some experiences that I hope you'll find helpful. And I really look forward to, engaging in conversation with all of you over the next 45 minutes or so. So yes, not too long ago, I was in college, and I went to University of Chicago for undergrad, and that school is it is very much a liberal arts school, so you don't have more professional majors, I would say, but I think I always had an interest in this type of work. It wasn't necessarily global health, but I think that I always knew that I wanted to do something in the area of international relations and, somehow working with governments, and sort of being in that space. And I took a pretty traditional path actually in college. I mean, I was a political science major. I spent a good bit of my work, more on the domestic side. There wasn't a lot really offered, to be honest with you, back then on the global side from an undergraduate perspective, unless you were doing more foreign affairs, which, I participated in, but I think one of the things that I've really noticed, in my time as a professional is just how much growth there really has been around global health, public health, and global development in the academic space. It wasn't there when I was an undergraduate. And so, I graduated school. I actually, interestingly enough, started to think about applying to law school. And again, I think same idea. I actually don't think I ever wanted to be a lawyer, but I think that it was a path that, seemed like the right thing for, the kind of work I wanted to do. And what was interesting is my best friend actually, we were both looking at graduate schools at the same time. And she was looking at both law schools and schools of social work. And what was interesting, I never really even thought of social work because I knew that I always wanted to be in the policy world. I didn't really want to do kind of direct practice. But as she was telling me about different schools she was looking at, it was clear that there were policy tracks at a lot of these schools. And given that I wanted to kind of go into that sort of area, I changed my mind and, ended up applying to different social work schools. And I went to the University of Pennsylvania for that. And I have to say, it really was a great experience in that, when you're in those schools, you do have to do direct, kind of direct client work. It's, the first year is very much in that way. And then the second year was more on the policy side. And I have to say, even though I wasn't doing anything global, I do think having that experience was very helpful to me. I think just interacting with individuals. I actually had a really interesting internship where I was working in a NICU in Delaware, working with babies that were highly premature and lots of different issues coming up, and it was a very interesting experience, I have to say. But that's really when I started getting, I think the second year was when I was starting to get more involved in global health, and it was really at the time where the global HIV pandemic was starting to become a little bit more known. And I did my master's thesis on a comparative study between the AIDS pandemic in Thailand and the AIDS pandemic in India, and really looking at the different ways the two countries managed, their disease burdens, and kind of what went right in Thailand and what didn't go so well in India. And it was a really, again, it really opened my eyes to a lot of different areas of global health. And so that's really where the first taste came. And when I graduated, I think some people may be aware of a program called the Presidential Management Fellow Program. And so I applied for that. And so here's where things get a little funny, is I ended up taking a position at the Social Security Administration. And it was, I don't even remember why I took it, to be honest with you. I wasn't really involved in that kind of work, but, I did it. And I was there for about 6 months, and then I got asked to move over to the White House, where I then spent about 2 years at the National Economic Council. And I was brought there at that point. President Clinton, there was a real interest in working on Social Security reform. And so that's when I went in. And so again, very domestically focused. I used to joke around that I wasn't an economist, but I played one on TV because I was just with economists all day long. And I just, had no background in that, none at all. But, in a lot of ways, it, and I still talk about that time. It really shaped the way I think and the way I work. I worked for an individual named Gene Sperling, and Gene, John knows that name very well. Gene actually is, I think he's actually back in the White House right now. And so he definitely has a reputation. He's brilliant. He's very politically savvy. His reputation is that he works all the time. And, he has a little bit of a short temper, let's say. I think he's mellowed with some age, but I have to say, it really taught me a lot about what teamwork is, really about working towards excellence on every single thing you do. I mean, I think that's why he was hard on people, was because he wanted it to be perfect all the time. And and I just, to this day, I'm grateful for that experience. I'm grateful to have, he was really my first boss. And I think that it was just a tremendous experience. And he also had the reputation for, giving people chances. And I think that's really what he did with me. I mean, he could have sent me back to Social Security after my, stint was over. And he basically said to me, look, I don't want you to go back. Social Security was not really going anywhere on the reform side. And he said, you pick your topic and you can work on that. And so I actually worked on a very interesting program that was an initiative of the Clinton administration called the New Markets Initiative. And it was an economic development initiative that the president started, and it was a way to bring economic development in low-income areas around the country. And what was great about it is the job itself was, a combination of policy work, of communications work, but also a lot of event work. The president did a lot of travel on this initiative. And, again, it was an incredible experience to be able to be part of that and travel with the president. And again, kind of being thrown into the deep end of the pool, kind of not knowing a lot of stuff, but, having a wonderful group of people to work with, and really having, an experience of a lifetime, I would say. And so I did that for a couple of years, and then went to Treasury for the last 6 months of his administration. And then as I was thinking about what I wanted to do next, that's really when I decided that I wanted to really go into global health. I'd had the taste of it in graduate school. And by this point, the pandemic was really just raging all over Africa. And it was something that I, really felt strongly about. And I was very lucky in that, through one of my bosses at Treasury, I was able to get introduced to the Elizabeth Glaser Pediatric AIDS Foundation, who that organization at the time was a small organization based in California, maybe 30 people in Santa Monica. And the new CEO was based in Washington, D.C., and she had maybe 3 or 4 people there. And I think I might have been the 4th or 5th hire, something like that. And that's really where the global health side came in. And, it was amazing because it was, again, at a time when the foundation itself was very domestically focused, but it was then moving into global health, and specifically around the prevention of mother-to-child transmission of HIV. And, this was before PEPFAR, this was before any of that stuff. And so, what I will just step back and you'll see this as I continue talking about the global health career side is, every step that I've taken, it's always sort of been at the start of something that was supposed to get bigger. And I think for me, it has just been such an incredible experience because at Glaser, we were tiny, not a lot of, government attention on global health. But, we started with the Prevention of Mother-to-Child Transmission Initiative that was in USAID. PEPFAR was created. The Glaser Foundation was one of the first grantees of PEPFAR. And just being part of that small group that was really helping the organization grow at a critical time. And, it was, again, it was being in the right place at the right time and being around people who were, willing to take a chance, bringing different people in who actually didn't have a lot of experience doing some of the things they needed, but, just being tapped to move on those things. And, And then I went to Friends of the Global Fight after 4 years. And again, that was a brand new organization when it started. And while it worked very intimately with the Global Fund, it's an independent organization. It was an NGO. And I was the executive director. It was the first time I ever ran anything. I wasn't even running a team, at EGPATH. And again, I was there for 7 years, but again, it was, this tiny little organization. Global Fund had just started, a year or two before then. PEPFAR was there. It was a very interesting dynamic between the two programs, very different than what it is now, in that, it was really seen as almost competitive with each other. And I think that job really, again, it was really about creating a structure around something, and also looking at the external space that we were working in with Congress and the administration, and how were we able to bring, the work of PEPFAR and the Global Fund together, and really trying to make it less of a competition, but more of, we need both of these things to actually have an impact in the world. They were very different organizations, but over time, and with a lot of work, and I certainly, John was there for a good part of that time. And I think, again, being very lucky, the context was right for all of this, from a worldview. There was a lot of attention on it. And just really having the opportunity to work with some phenomenal people, and really kind of, again, moving the ball forward. And then in the last position, I took a couple of years off. I needed a little bit of a break. I became a parent, and I just wanted to spend some time with my family. But after about a little less than 2 years, then I started working in Gavi. And again, when I started at Gavi, this was an organization that, a few people came to me and they said, literally, it's such a great organization, but it's the best kept secret in Washington. Nobody knows about this thing. And it's kind of funny to think that now, but again, and we were a year before a big funding meeting that was happening that, is called Replenishment. And, my then boss, Seth Berkley, I think knew what I was able to accomplish with the Global Fund, which was really increasing the funding from the US, year on year. And he felt like that was really important for the US to do with, Gavi and the issue around immunization. And again, it was a totally different type of work. But, again, it was building something that really didn't exist before, from the US angle. And what was also interesting about this job is it wasn't sitting side by side with the entity. I was now like in the belly of the beast, as I always used to say. And that also provided me with a lot of, information. And, I wasn't just the advocacy person anymore. It was really about learning about the programs and the activities of the organization to actually ensure that children were being immunized around the world. So I think that being in a multilateral, actually being in that organization, provided me a level of insight that I really, quite frankly, never had with the fund, even though I worked so closely with them and was in Geneva all the time. But I think being in the organization and understanding how a multilateral works from within was also, an incredibly helpful and enlightening experience. And I was there for 7 years, and I also was ready for a change, and I felt like, after all this time, even with COVAX and all the work I was doing there, I think I was ready to do something a little bit different. And when the election came around, I thought a lot about whether I was ready to go back into government. It had obviously been a very long time. And and again, you know, sort of being in the right place at the right time. And, you know, I started at USAID February 8th. And, you know, it's hard to believe it's only been 2 months. It does feel like it's been a lot longer. But, you know, again, it was jumping into something very different. You know, someone mentioned to me, like when I was making my decision about it, someone who is also actually also in the agency now and was there before, you know, said to me, look, I think this is a great job for you because, you know, I have been, and I never really thought about it this way. I have been so narrowly focused on a particular health issue for every part of my career, whether it was HIV, whether it was malaria, whether it was immunization, whether it was TB, but never sort of a much broader view of global health. And the way she put it, and I think it's exactly right, she's like, this job is going to widen your aperture in a way that you just haven't done before. And, you know, she was absolutely right. You know, there's a lot that I work on right now that I, you know nothing about. And, you know, so I'm learning and managing at the same time. But I have to say, it's been an incredibly exciting period. It's hard. You know, COVID is a big part of my portfolio. And, you know, it's a lot. It's a lot. But, and John can, you know, attest to this. You know, I've always been someone who, you know, when I work, I sort of put it all in. But, you know, I really feel privileged right now to be in an environment where we can make such a difference at a time where the world is looking to us. And, you know, the United States was absent in a lot of this work for, you know, 4 years and 4 difficult years. And, you know, we are playing some catch up. But it is such a privilege to be able to really be very much involved in some of the world's biggest challenges, and hopefully, you know, being a part of the solutions that are really going to help us as a nation and as a world, you know, move out of the state that we're in right now, and hopefully, you know, be able to come back in a way that it's going to take time, but that we're able to be able to build back and ensure that all of the investments that this country has made over time in global health, that we don't lose them, and that we actually do things as we're working to end the pandemic, that we're actually doing things to build stronger systems. Because, you know, as my old boss used to say, it is a certainty that we will, you know, there will be another pandemic. And it's now all about what do we do to ensure that we have the systems in place to ensure that it doesn't turn out the way this time did.
Like I told you, Natasha's had an amazing career. So I think it's fabulous. So let me ask a question, then I'll turn it over to the students. But I wanted, as you noted, I can attest, Natasha is all in when she does her work. It's very impressive. I've been on the other end of her advocacy, and she's very good. And she eventually got me on the straight and narrow a few times on different issues over the years. But so maybe just like to pick up where you ended with where we are at this moment. Whether you were at Gavi or at Friends, or in the role you're in now, you have to make the case to the American people and their elected officials that this work matters. And in some ways, you'd think a pandemic would bring that home, but as we all know, that's not necessarily true, right? And so I guess I'd love your thoughts after you've seen how different coalitions and different ways of thinking about making the case for why it makes sense for America to invest in global health. what do you see as being most effective, but then maybe especially in this moment? Like, what are the arguments that resonate? Who are the people that need to speak? How do we make this work?
Yeah, I mean, it's a good question. And I think the answer to the question is different for, in some ways, for each phase of what I've done. I think on the HIV side, when we were starting that process in the very beginning, I mean, a lot of people have said this, that it was a movement, and I think at some point, I mean, I think people have been writing about it, but
Yep.
I think on the global side, it really was, the coming together of people, and it was really the moral imperative that I think moved people, right? you know, I, I wasn't in the Bush administration when PEPFAR was created, but, know a lot of people who were there when PEPFAR was being created, as John does. We've heard a lot of the stories. I think that from what I understand, there were people in the White House, and quite frankly, it was the president who led the charge at that time about, we have to do something. People are, dying all over the world. And yet we also, we have people who suffer from the same disease, but we're not seeing it just completely take over in the way we were in Africa and in Asia at the time. And I think what really moved people at that point was the moral imperative. Like, as the world's superpower, were we going to stand by and let this happen? And and I think that when I think about what worked then, the kind of advocacy that moved people was really sharing those stories about how people were suffering. Medications weren't available. They were, again, they were available, but they weren't available to them, right? They were too expensive. They just didn't have access to them. And I think back then it was more of a moral, we can do better as a country. I think over time, and look, and I think that the work that I did and the work of countless others to really build coalitions and build support both within Congress and within multiple administrations, right? It wasn't just the Bush administration, it was the Obama administration as well. And quite frankly, the Trump administration too. I don't quite understand that completely, but but there was, it became an important part of the process for people. And, and I think in the beginning it was, the strangest bedfellows, right? You would have the most liberal of Democrats, wanting to focus on these issues, and then the most conservative religious Republicans who wanted to do it. And, different things were motivating them, but it was really an issue where people came together. I mean, there were moments where I was in meetings with senators and I couldn't even believe that I was A, talking to some of them about this, and B, that they were even talking to each other about some of them. And, I think it was, I think it was just a very poignant time. And I think it was a lesson for where we're going now, so then all of a sudden it was not just about HIV. I think, there was more of a movement around global health. And again, I think it's something that people have really understood. And I think the other part that has been very important around this has been impact. I think that while, now that it's 20 years later, there are things that need to be improved about how we show impact. It's not all about outputs, it really has to be about outcomes. But, when the administration first put PEPFAR together, they were very clear about the goals that they wanted to reach. And I think for members, they could see, okay, you said you were going to reach this many people with antiretrovirals. You did it, great. we can continue with the funding. So it was a way of showing that the funding was actually being used for what we said it would be used for. You know, with Gavi, it was similar. I don't think that, you know, everybody knew that, you know, children under 5 in poor countries were dying, right? Like everybody realized that. You know, I think again, it wasn't opening people's eyes about these issues. I think a lot of people knew. I would say with Gavi, the thing that made it, I think what allowed us to be so successful, quite frankly, was how a small amount of money, and compared to the Global Fund, it was a small amount of money. You know, when I started, the appropriation for Gavi year on year was 175 million. At the time that I left Friends, we were over $1 billion a year for the Global Fund annually. So very small amount of money, but the impact that we had was huge. And I think with immunization, it's about as clear as your money is going to buy these 15 vaccines to go to this many countries, and here's how many children we immunize. And here's how many lives we were able to save because of these immunizations. And so for immunization, it was a little bit of an easier argument, if I had to be totally honest about it, you know? And I think for that, it was, you know, this is a good investment. You know, we get a lot for what we give, you know, and also the US wasn't the biggest donor. And I think that helped a lot. You know, I think the US doesn't really like to be the biggest donor in many cases. And I think that's okay. But to be the 3rd largest donor, the 4th largest donor, and to be able to show that kind of impact, it worked, you know. And I have to say that, you know, the thing that was sort of the most, why I felt okay about leaving Gavi when I did, was about a month beforehand, we were able to get $4 billion from Congress to support COVAX and to ensure that vaccines were able to be purchased for 92 low and middle income countries. And, you know, it was a little bit like, I really can't do more than that. So it's time to go. You know, like I felt like I really left on a high and felt happy about it. But to be honest with you, when you go from an appropriation that's $290 million a year, and somehow we were able to convince people that this organization needed $4 billion over a 2-year period of time to do something that, yes, I mean, you know, we had the experience in doing immunization, but COVID's a very different thing. But I think it was because Gavi is an entity that people know its impact, they know how it works, and this was an important way to, you know, going back to your original question, John, like, why did people care about this when people were dying in the US? Was because a simple argument that if there are pockets of this disease anywhere in the world, we're not going to be safe here either. And I really do think that that was the argument that worked. You know, it was important. Immunization, I think, was, you know, in many ways, it's seen as a silver bullet. I don't think it is, but it's a very, very important part of ending this pandemic, right? Or the phase of the pandemic that we're in. And I think people really, I think there was self-interest there. But I also think that, you know, people really realized that, like, you know, we're not going to close off our borders. You know, we can't, we're just not alone in this. And it was, I mean, it's really incredible when you think about it. Every single place in the world has been hit by this. There's nothing that I've ever experienced where I can say everybody in the world is experiencing something similar to what we are experiencing here. And I think that resonated. I really do.
I think, and I just say this to class, a lot of you have mentioned over the course of the semester, you know, how much you want to be advocates or try to improve public policies that affect vaccines or just global health in general, the kind of nuance and message discipline that Natasha lays out, at least in my experience, is what works. It's understanding the circumstances, understanding your audience, and understanding that message. And her answer was really, I think, I hope you all take to heart, it's really a powerful one. So let me do this as we do. I will turn now to the students in our class who prepared the briefing emails. And so I'm going to start with Kayla and then turn to Samantha. So Kayla, would you like to ask the first question?
Yes, thank you so much for speaking with us tonight. I really enjoyed hearing about your experiences in the government and at Gavi. I had a more specific question about public-private partnerships because they come up so frequently in our global health courses at Georgetown, and they've really been praised as kind of a key to solving really difficult issues in global health. And I was wondering, based off your experience at Gavi and working in relationship with the Global Fund, if you could speak a little bit about what the most powerful or redeeming qualities are of public-private partnerships, whether you agree that they're kind of a key to solving global health crises, and kind of in which situations have you seen them have the greatest impact?
Sure. So I do. I mean, I've been very lucky in that, I think everybody, public-private partnerships is it's a little bit of a buzz, it's a buzzword, right? But I do think that at least in my experience, I think part of the success of both the Global Fund and of Gavi was the fact that they brought every type of stakeholder to the table. It wasn't just about governments giving money. It wasn't just about, the pharmaceutical companies. It wasn't just about, everybody had a role to play. And I would say most importantly, and I think this was a change, with starting with global health, is that the countries themselves were very involved in these discussions. And I think it's so important. And I think I'm seeing it even more in this time of COVID, where, countries are demanding, they want the vaccines they want. They're working hand in hand with the institutions to get what they need. And so I do think it's really important to have different stakeholders. I mean, as far as the private side of things, I think what's also interesting about that is I think when this all began, everybody thought of the private sector as just being another donor, right? And look, they're important, they have money to give and they should be giving it, right? But I think over time, and what I saw when it was percolating at the Global Fund when I was there, but I think I really saw it much more up close when I was at Gavi. And I think, it's the case in the Global Fund now too, is how do we use private sector expertise to really help us figure out how to manage some of the challenges that we have, and at Gavi, there was, we have a pretty impressive set of people that are working on innovation and private sector partnerships, and they kind of run the gamut. We had a partnership with Unilever in India, and it was a partnership where there was a lot of advertising around wash issues, so basic sanitation, washing hands, doing things like that. But the partnership was in connection with the pneumococcal vaccine. So there was a lot of advertising going on in parts of India to help people, kind of prevent from getting, sorry, it wasn't pneumococcal, it was diarrhea, sorry. And then they provided money to basically give Gavi to then purchase vaccines against diarrhea. So, I think there's a lot of kind of creative ways that we can be utilizing that private sector expertise to help fill the gaps that we have and help us on the ground, whether it's with just supply chain, whether it's behavioral change, whether, it's, and I would also say with Gavi, I mean, the private sector is a key part of the organization because that's the whole premise of Gavi. Like, we were able to show the vaccine manufacturers that there is, we don't have, they're getting less for each vaccine, but the quantity in which we are working on, Gavi is vaccinating 60% of the world's birth cohort. So we were able to drive prices down because of the size of the population and the demand that we were creating for the manufacturers. So, I think that it's a really important part of an overall process. And I think, like I'm sure you've heard in all of your classes and, everything you read, every stakeholder has a responsibility and a role to play in a lot of this work.
Thank you, Natasha. And let me turn to Samantha next, if I could.
Thank you so much for coming to speak with us today. So I had a question about how the COVID-19 pandemic has threatened the progress that has been made on HIV, TB, and malaria. So what are some recommendations to ensure the continuation of this progress? And also, how can we prevent future health crises? Like you said, pandemics are something that's going to be happening more commonly in the future. So how can we prevent these crises from impacting the allocation of resources and attention to these important health illnesses in the future?
Sure. So I'll start with the first question. So I think, the COVID-19 pandemic has, it's hit every part of the development portfolio, whether it's health, whether it's food security, whether, we've lost decades of progress because of the virus. And, for different reasons, some of it is because, some of the social distancing measures that people had to take stopped individuals from going in to get vaccinated or get their meds, or, but what I will say is that there were also a lot of, again, ways that countries really tried to ensure that, certain things were continuing, but, it has been impacted. And my understanding is, for something like TB, there's been like a huge hit on what's going on with TB and the number of infections that have increased, and, loss of, basically people aren't getting tested and therefore not getting medication. And so, a lot of these areas have been very, very hard hit. And, what we're actually working on, right now is, I think everybody is aware that, in the last supplemental that was just passed by Congress a few months ago, called the American Rescue Plan, there actually was about a little over $11 billion that was included in that almost, I don't remember, was it almost trillion, was it, John?
Almost 1.8 trillion, I think.
Trillion, okay. So it's
an unbelievable amount of money.
Right. And $11 billion is so much money, but when you look at what the percentage was of 1.8 trillion, but, right now we are, working on, how are we going to use that funding? I think, for health, the way we're looking at it is, how do we ensure that countries are ready to get to give out the vaccine when the vaccine comes? So country readiness. But it's also about mitigating, like vaccines are not going to, they're not coming as quickly to poor countries as they should be. So what are we also doing to ensure that people aren't dying of COVID, right? So, there's the treatment, the diagnostics, all of that needs to occur as well. But then we also really do have to look at what the secondary impacts of COVID have been, and what are we doing to ensure that we can bring back these, all of these programs back and build them back better. And I think as part of that, and actually as part of the country preparedness, and even as part of the, ensuring that people can, fight COVID, whether it's with PPE or diagnostics or treatment, it's also about ensuring that the systems that we're using to move these things along are strengthened along the way. It's interesting. and John knows this, the term health system strengthening, we've been using it for such a long time. And for the longest time, you'd say it and everybody's eyes would glaze over because nobody knew what it meant, or it meant different things to people, or they're like, oh, that's just a way for you to like give budget funding to countries and they'll just use it for whatever they want. We can't really figure out what they're using it for. And then first came Ebola, and now COVID. And, now we're seeing when you have weak systems, what happens. And so I actually, I just said this to a colleague today, I think health systems is about to have its day in the sun. I think that we are really seeing why strong health systems are so important, not only for all the programs that we have to, that are just the global health programs, but you need strong systems to create pandemic preparedness moving forward. You need good lab surveillance, you need strong, human resources in health, you need good supply chains. All of these things are part of strong systems. And, so as we work to overcome the pandemic, I think what we also want to do is do it in a way that is also strengthening the systems so that as we move forward, when this happens again, systems are ready to deal with it. And I have to say, people may be aware that there has been an Ebola outbreak recently in Guinea and DRC. And, it was actually my 4th day on the job when the outbreak was reported. And, I will tell you that a lot of us were like, oh my God, like now it's Ebola, like how are we going to manage COVID and Ebola? And when you look at what has happened in these countries, DRC hasn't had an infection in double-digit days. Guinea is, I think it's a little bit behind, but again, we didn't have a huge outbreak. And again, I think it's because the systems that were put in place during the big, in 2014, when they had the huge outbreak, and then again, a few years later, those systems were working, and people were able to come together quickly and really do the contact tracing and do everything that was required. And we had a vaccine. So, I think that is a pretty interesting lesson learned that, if we can put this effort in and really, I think, front load the investments on these things, it will have an impact in the future. And that's really how you have to think about it. It's an investment for the future to ensure that, hopefully we never go through this again.
I couldn't agree with you more. I just think the pandemic is the proof point for defining health systems. I do agree, it's such a big word, it's hard to get your head around, but this is the illustration. And frankly, in our own country, the failures of our public health system from underinvestment over long periods of time, I think, are also evident in a way that just you wouldn't have seen otherwise. I think we probably have time for one more question. So anybody else?
I was going to say, given that I've been droning on so much, I'm happy if there are more questions, I can, stay for an extra 10 minutes. So. Oh,
that's nice. Oh, thank you. Well, no. You haven't not been droning on, but I was just, but I want to respect your time too. You've had I can assure everybody on this call, Natasha's had a full work day before she joined us. So how about another question? I'll look. I think a small enough group you can raise your hand. I'm happy to. Anybody in the class more broadly, or Matt? I guess we do have a guest. I think we've got Matt also out there too. So all right. Well,
I'm all set. Thank you.
Okay, we may. Oh, wait a second. I see a hand up now. Okay, I've got Lydia and Shoa. So how about we start in that order? Lydia, Shoa. Lydia, please.
Yeah. Thank you so much for being with us. And I'm not a global health person. I just was interested in the topic and ended up in this class with people who know a lot about it. So forgive me if this question is not, I don't know. But basically, I've been kind of following the response of people in other countries to like the rollout of vaccines. And it seems like people are listening a lot to like US institutions, people like Fauci and the FDA, and like kind of I don't know, all the things with like the AstraZeneca vaccine and different vaccines from different countries, it just seems like people in other countries really respect US institutions and what they're saying. And so I was wondering with like Gavi and other organizations that you've worked with, whether there's a benefit other than the money that comes from the US, like to having funding from the United States in terms of how other people view the work that you do. So like, is there like a non-monetary benefit in addition to the money that you get from the US?
That's actually a great question. Yes, I would say. So look, I think, again, in all of my experiences, look, the US, countries do look to the US, right? And I do think that, as it related to the Global Fund, as it related to Gavi, when the US comes in on an investment in a strong way, people notice it. And I think that, again, I do feel like I've been very lucky in my career where when we've been able to show increases from the US government, when the US started giving more money to the Global Fund, when the US started giving more money to Gavi, it did put pressure on other countries to do the same. Right now, they're not going to, necessarily be at the same level because, they're just not investing that, in that same way. But it does become, and John can, take about this too. It becomes a little bit like a friendly competition. I think nobody wants to look bad in front of each other. And I think it is really important because I think when the US shows leadership in that way, people notice, and I will say that even, being in the administration now and, going into meetings, where the US is coming in for the first time, whether it's a WHO meeting or an ACT Accelerator meeting, people do say, we're so happy the US is back, and quite frankly, we're coming in with a lot of money, whether it's for Gavi, whether it's for the Global Fund. And I think it is it's noticed and I think it helps. And I also think it's also about American, even as we look at some of these other issues that we're having right now around, the global supply of vaccines, again, it's not just the money that we bring to the table, but it is our expertise and work. So, talking about the FDA and, and what we're doing, what we know about vaccine supply, what we know about manufacturing, and using that level of expertise to really work on working globally with people about how do we help solve some of these problems. So it helps with funding, but I also think American experience and expertise is also, very relevant to these areas.
Excellent. Oh, thank you. And so,
Thank you.
Shoa?
Yeah, I just wanted again to echo everyone's points about how thankful we are to have you with us today. And particularly your point about bringing stakeholders to the table and creating those forums for countries to demand what they need really resonated with me. But of course, obviously you've experienced this, but the US government also engages a lot in policymaking and program planning. And like you said about the vaccines, there is benefit in centralization and economies of scale. So I was wondering if you might be able to talk a little bit about how you toe that line between advising and advocacy.
So I think it depends on the job that you're in a little bit, right? Well, actually, I'm going to take that back. I mean, I think maybe the definition changes a little bit, right? I think I look, using the position that I'm in now, I'm still an advocate for things that are important, right? People have to be talking about, why we should be doing certain things. And so even though I'm not necessarily doing the same kind of advocacy that I was doing when I was on the outside, we need internal advocates to push certain issues, right? I mean, if I had to think back, and John probably did this too, that for specific initiatives that people think are important to do, in the time that we're in, when we're in power, requires advocacy, right? It requires knowing, how do you pitch what's important and talk to the right people and say, look, this is good for the administration to be able to do for these X, number of reasons. And then, but you also are advising too, it's also about how do you, when you are working with different types of people, it's about ensuring, and it happens at every level, right? I have people who are advising me on how to go in. I mean, quite frankly, I have people advising me sometimes on how best to advocate for something, because I may have the platform that is required to actually, my voice is going to be listened to in a way that's different than others, right? But the subject matter experts are the ones that can help prepare me best to be the good advocate, if that makes sense. And then I do the same thing, right? At my level, I'm also advising my seniors on, how to manage issues and how to advocate. And, and look, sometimes, things are going on and, you may not be so happy about, kind of how things are playing at a certain moment. But I do think that it's also an opportunity, you've also got to get your timing right, right? And it's about knowing when to advocate and what's the right time to do it for the particular thing you're interested in. I don't know if that answered your question or not, but.
No, that was great. Thank you.
And so why don't I go to Velen for the final question then? So please.
Okay, thank you. You talked about how during COVID, everyone in the world is experiencing something similar, and that's sort of bringing us together as a global community. And so I'm wondering, how can we find a balance between this shared narrative and recognizing the differences in experiences because of, say, like social determinants or geographic locations?
Yeah, no, and I think that that's also a really good question, and it is important to understand. I mean, I think where we are with vaccines it's an interesting conversation, right? I mean, and it's not even just, the difference between rich and poor. I mean, I think the way we're dealing with this in the US, where literally the entire country is going to have, 16 and up is going to have access to vaccines in, at least in the next few days, if they don't already, is a very different experience than what people are having in Europe, and a very different experience of what is happening, in poorer countries. And, I do think that while this is something that can bring us all together because we do have a lot of shared experiences, in some ways, I feel like that's why I'm in the job that I'm in, is because of these differences and really working to ensure that, everybody around the world has equitable access, and again, if you look kind of, you step back for a second, the fact that there have been countries around the world that have literally been, have received the same vaccines within a month of when rich countries got it, that's progress, right? That is progress, but it's not enough. And, and like I said, if I really had to think about what motivates me every day to, to work this hard and do what I'm doing, it really is to ensure that we use the opportunity we are in, now with our president and with our leadership to do everything we can to make sure that everybody around the world, has the access to things that some of us already have. And like I said, if we don't do it, we're never going to get out of the place we're in. So
I think that is an excellent place to end. And I really, Natasha, I can't thank you enough for joining us. So first off, guys, everyone, for one of our virtual applause.
I clap for you guys too. It's been, like I said, it's nice to have the last Zoom call of the day like this. So thank you for giving me the opportunity too. It's been a pleasure.
Well, your career, I mean, I just hope everybody, we've talked about throughout this whole class about different ways. We've talked to doctors like Eric Gooseby or immunization experts like Bruce Gallen or Peggy Hamburg, who is the commissioner of the FDA. Everybody there has found their way with their own expertise, with their own history to make a difference. Natasha has found a way. I mean, the work that she's done over the last 20 years in global health has resulted in millions of lives being saved. I mean, this is no small achievement, and I'm hopeful. As you all know, everyone knows where I come from on this. I'm very hopeful about this administration, and I think that we've got a real. I mean, this is how advocacy and policy making can really make a huge difference in people's lives. So anyway, it was great to have you here. What a great story, and keep up the good work. We're really excited. So anyway, thank you, and I will let you go, and I'll ask everybody to stay on. We'll take a few minutes to wrap up with just the class.
Great.
So
All
thanks,
right. Well,
Natasha.
thank you, everybody. It was a pleasure, and have a great night. Thanks, John.
Take care. Bye bye, Natasha. See you. You too. Be safe.